one of the only machines that regenerates tissue, and that will be a StemWave machine, also known as a Shockwave machine or extracorporeal Shockwave machine. Hi, I'm Dr. Dabbs. Today I want to talk about an exciting piece of technology and treatment for regenerative care. If you look it up, you'll see major great results about it, up to 95% success rate at treating all kinds of conditions such as lower back pain, neck pain, foot pain, plantar fasciitis, tennis elbow, and shoulder injuries where you have a rotator cuff tear or you have a capsular tear. This machine is incredible, and it goes down around 6 inches of acoustical shock waves to break up scar tissue and replenish new blood vessels, which come in like crazy to build in there. And those new blood vessels bring nutrients to rebuild collagen, new tendons, new ligaments, and break up arthritis, for example. So what is arthritis of the lower back? Well, let's take a look. First of all, here's your spine, just like how I'm standing here now, and this is the back part. So these vertebrae here, especially the lower ones, they get a lot of stress from car accidents, old sports injuries, sitting at computers all day, or just wear and tear. And they start to degrade, or they don't move properly. They start to pop out of place. The mechanics is not correct anymore. The muscles may be weak, or the tendons are torn. So what we need to do, and this happens just about everybody eventually. So what we want to do is prolong that till at least 120 years old. So we want to make sure you don't get the pain from it. So what does that mean? Well, here's a normal, if I pulled this out of my lower back, that's a normal, young, 20-year-old spine, good shape, right? It twists and turns, and you can do all kinds of acrobatics with that, good quality spine. But over time, maybe you got in a car accident or lifted a heavy piece of equipment, it will cause degradation of the tissue. So you'll see like it has teeth along there. And what we need to do is reverse some of this. So this, we cannot reverse back to this, but we could take 10 to 20 years off of this just by getting cartilage to grow back in there and by creating mobility, which is what we do as chiropractors here at the office. The other problem with a disc is the discs in your lower back. So let's pull it out. If I was to push down, there's a disc bulge right there. And that disc will bulge under the nerve because these ligaments are not holding it in anymore. And the disc is like a jelly donut, a jelly comes out. So we basically tried to push this thing back in place with decompression, pulling it apart, or chiropractic treatments, exercises, rehab. What does the Shockwave machine do? Well, it sends out sound waves. What those sound waves do, they bombard the scar tissue and the degenerative tissue in here with sound waves. And they go boom, boom, boom into the joints, into the disc, and it will start to promote new blood vessels growth. And then that new blood vessels build building blocks and stem cells to the area. And it'll happen immediately. And for the next 4 months, it'll start building in so it becomes much younger of a spine with new collagen, new blood vessels, new tendons, new muscles, and it starts to move a whole lot better. Pain is gone. Or with the disc bulge, it will create we basically try to push this thing back in or decompress it back in. And then we get the StemWave in there to rebuild the ligaments, to hold it back in place. And all new blood vessels go in there, and it will basically push out inflammation, which causes that pinched nerve down the leg. You help inflammation, a lot of the pain just rapidly goes away. So it takes about 5 to 10 treatments of StemWave or Shockwave therapy. So let me show you the machine. This is it right here. This pumps out shock waves, but in a soft wave form, which means I can turn up the energy to go 6 inches into the body and do its magic. And we do that by basically taking this wand, which will shoot out the acoustical waves, and we place it over top of where the problem areas of the back. And what it's doing is it's pumping in shock waves. And they're going right in. So this is painless. So these shock waves go in, and we just go to the area of where the problem is, and we keep using it for about 5 minutes. So that's typically how we work the machine. And about 5 minutes later, she's done. She's ready to go to take on the day. This machine here is critical in getting the back to regenerate and reverse its arthritis by up to a decade or more. So if you have any questions or inquiries or want to learn more about it, come in for a consult. With that consult, we can demonstrate it with you. We can go over what is Shockwave therapy, show you our office, find out more about your condition, come on for the consultation, or put a comment below.